Hello, everybody. How you doing? Dr. Todd Pickman from Move Now, and I'm here with Dr. Jeff Cronk from Smart Injury Doctors. Smart Injury Doctor or Doctors?
Either one. I have both.
Either one, depending on what day of the week it is. You want to add the S?
If you look at the site, there's doctor and doctors.
Gotcha. All right. Just to make sure that you got both of them. That was smart.
I got both of them.
That is the attorney in you, isn't it?
I don't know what that was in me. No, that's the buy a lot of titles with GoDaddy.
Oh, gotcha. Okay.
Money.
Well, everyone, if you're joining us now or you're watching this unlive, not live, this Saturday, Dr. Jeff Cronk and I are going to do a webinar where he's going to take you behind the scenes, show you inside of the program, what it is. Some of you have been following this for a little bit of time here. I'll fill you in real quick. Okay. Dr. Jeff Cronk, practicing chiropractor for 17 years, then went to law school, became an attorney. And now in the whole span of things, it's been like 30 years since you graduated chiropractic school?
Yeah. Thanks for bringing that up.
Yes, okay. And Dr. Cronk and I, our paths crossed back in end of December. One of our doctors inside of our program said he was ramping up his personal injury work, and he said, you need to check out Cronk stuff. It's awesome. And so I started looking at it. I joined it right away, started digesting all the information, reached out to Jeff here, and I'm just going to say Jeff.
Yeah, that's fine.
First name, Jeff, Todd.
Yeah,
okay?
Todd.
All the formalities are gone right now.
Right.
And so anyway, so Jeff and I we've talked multiple times. I showed him what we're doing with functional rehab. He helped give me even more pointers inside of his program. And at the end of the day, the reason that I'm doing this is because, one, we are using Jeff Cronk's stuff in our clinic. He's a huge asset to what we're doing in our community to dominate the personal injury work, not because we're going to agree to cut our fees and be, sleazy but we're going to do the best level of clinical care, which is how we always start with this anyway. But now we have this other thing in the arsenal that we're going to talk about today, which is understanding spinal ligament injuries and how to talk to attorneys with that language. But another reason that I'm doing this is because it just so happens that Jeff Cronk's program that he had extremely discounted forever, he's actually going to raise the price of it to where it should be, which I think, because there's so much stuff in it, it's nuts how much stuff is in it. And that goes up, it's Monday, right?
Yeah, that goes up Monday. So Sunday night, 12 o'clock, you won't ever see the lifetime price that we're giving it at right now.
Okay. So this is not just some kind of ploy to say, okay, it's coming back. I mean, this is real. It's going away. And so I asked you, I said, hey, is there a couple of things we can do in front of our group? Because I know there's a ton of our doctors who are going to want this stuff. And if I don't say something 2 months from now, they're going to jump on. It's going to cost 5 times as much. And right now it's a super huge deal for them to jump in. And so anyway.
Yeah, I'll tell you what, Todd, and I appreciate what you're saying. I mean, it'll be a huge deal at 5 times the cost, but right now it's like astronomically low.
It is.
And so we can talk about any topic. I've been around in the personal injury market for a long time. And so, and I just appreciate you bringing me on. Look, you're functional rehab doctors. I called my program Smart Injury Doctors because I felt that patients needed to go to a better, higher breed of doctor because they're such at risk for long-term residual complaints when they get an injury.
Sure.
So you, with your doctors that are doing physical rehab, you're already, the horse is way out of the gate when the other horses are still in the gate as far as results go. So your doctors are perfect doctors to go into the personal injury market, or if they're already in it, expand more. If they want to protect their market, to protect it, because it just depends on where you are. I mean, practices that are seeing, 60 to 100. I have one that's seeing up to 500. Their whole thing is they want to protect what they've got. So they want to know every new thing that's coming down the line so that they can protect their space. Others are in, everyone's in kind of a different space when it comes to personal injury, but all doctors in the personal injury space have got to be able to start to differentiate themselves. And in the future, when I say future, it's already in the future right now, where there are companies that will keep statistics on how good your results are. be able to direct. This is occurring. It's already started to occur in the work comp market. It'll occur in the work comp. It'll occur in the personal injury market, where patients will be directed to doctors, not so much based on cost, but based on results. Like, okay, how good are your results? You know, the days of, hey, everybody comes out of this clinic and they're all messed up. They got bad disabilities. They got bad impairments, and bad impairments can be bad, but bad impairments where the person still experiences a lot of problems with that impairment, that's the problem. So you can have an impairment. If a person breaks their neck, that's an impairment, right? So if they do a 10% compression fracture, that's an impairment. If you have a 17-year-old, 25-year-old that has a 10% compression fracture, it's an impairment, but they don't have to live the rest of their life with problems from that impairment. You can do things around that impairment that improve the person so that they, you know, live a good life without chronic pain.
So ultimately, a big part of why you and I are talking together is because both of us share one commonality, is that it's all about best results first. That's the number one thing, is lead with results. And if you start with that, then you can build lots of relationships. You can get your foot in the door in a lot of places that would slam the door in your face. Yep. And for this brief Facebook Live that we're going to do right now, let's just talk about the best way to get in and talk with attorneys. So let's just assume that you went in, you talked to an attorney, you said, hey, look, we're very different. We'd love to get in front and talk to you how we're going to make life easy for you. And because of the fact that we do these 5 things, I mean, that's something that you teach inside your program, is those 5 different things.
Yep.
And then you have PowerPoints inside your program on how to actually give this presentation. But why don't you just take us through that process of how would you approach an attorney to say, hey, attorney, here's why you should be working with me?
Good. So if I was calling an attorney and there were 30 attorneys or 60 attorneys in my local area that I wanted to work with, the first thing I'd do is I'd be calling the attorney and saying, hey, look, I'm an injury doctor in your local area, and I want to actually start sending patients to you. I want to start sending referrals to you. I want to develop a relationship with you. I'd like to meet with you. Period. Right now, there's not an attorney usually on the planet. If you had doctors, just think of it the other way around. You had a local attorney that said, hey, look, I do a lot of personal injury work. I'd like to develop a relationship with you, and I'd like to develop a relationship where we start to send you referrals. Not one of you is going to go, oh, I don't know. I don't think I have enough time for that. You know, maybe we can work that in next year. You're going to go, oh my God, you know, Betsy, get in my schedule.
Right.
So everybody wants the same thing. So when you're going, I don't care if you're going to medical doctors, you're going to attorneys, you're going to somebody, everyone wants, what are the benefits to me of working with you?
Right.
So you want to lead with that. Now, the other thing that you want to do that's really important to do is there is a ton of noise in the personal injury market. So there's this big, broad market called personal injury, and everybody wants to be in it. Mm-hmm. And they want to be in the whiplash market. Okay, what I've said and what this program is all about is you can be an expert or a leader in a niche in that market. And when doctors get in that niche, what they're going to find is there's no one in that niche. There's no neurosurgeons. There's no orthopedic surgeons. There's no other chiropractors. There's no physical therapists. There's no one in that niche. And that niche, oddly enough, is a spinal ligament injury niche. So I say this all the time. Todd, when I present live, and I used to do it kind of in a kind of weird hard ass way. I don't do it that way anymore.
Hard ass way.
I learned, you know, it didn't go over well, but, you know, I just say, hey, look, how do you determine the severity and location of a ligament injury? And it would be crickets in the room. I mean, 150 doctors. Now, it didn't matter if I was in a medical or if I was in a chiropractic, it was the same. Right. So it was like, well, orthopedic testing. Well, there is no orthopedic testing for it. Well, our examination procedure, there's no examination procedures for it. There's combinations of exam and imaging. Right. So one of the things you have to have, in my experience, to fight the noise is you have to have something that makes you unique that somebody would want to work with. Think about, God, I don't know. I'm an automotive shop. And so I've got a new diagnostic procedure that allows me to hone right in. It's more effective. You get better results. We're faster at getting you in and out. We're cheaper and we're more accurate at exactly what you have. And we're not going to screw around with anything that you don't have. You go, okay, I'm going to listen to that guy.
Mm-hmm.
Right? Now the person says, well, we're the best. Well, what makes you the best? So you got to have something that you're going to that cuts through the noise in the market, because attorneys, they have a lot of noise. They have a lot of doctors, a lot of people that are coming to them that are saying, hey, I want to work with you. I want to work with you. I want you to send your patients to me.
Right.
And you already have established relationships. So to get outside of that noise, you got to find something that makes you unique. And that's what this program is about. You become very unique.
Sure.
And so you become, when your question was, how do you get to them? One, you just call them and offer them a benefit that they're already interested in, usually, which is patients, clients, that their term is clients.
Yeah.
Once you're in the door, then you can start to show what makes you unique. So one, you don't miss injuries. So just if, and also think of a relationship as, I recently heard, last 6 months, people buy or go into a relationship 2% of the time on the first contact, 2% of the time on the second contact, 2% of the time on the third contact, 4% of the time 4% on the fourth contact, and the 5th through the 12th contact. That's where 80% of the business relationship is made.
Sure. Yep.
So, I liken it. Doctors will say, well, God, I went into their office once. I was like, yeah, did you date your wife once? And she just said, man, I want to marry you. This is it. Right. Mm-hmm. So you do have to sell yourself continuously on what it is that makes you unique. Like your clinic, Todd, for example. What makes you unique is, yes, you have this niche. Yes, you have rehab. Yes, you teach the rehab. Yes, you're really good. You have a background in doing testimony. Mm-hmm. Those are all benefits, right? Sure. They don't even, the features are now, okay, here's how we do this program. Here's how we do the diagnostics. Here's how we do the, run the outcome assessment procedure. Those are all features, and those are all great. But it's getting yourself so that you're pretty unique when you go in the door, so you have something unique to talk about that they haven't seen. Yeah. Once you start talking about those ligament injuries. So attorneys, when you get to ligament injuries, attorneys just think of discs. The disc is 10% of the ligament structure of the spine.
Right.
So
I'm looking to see if I have one of those 3 biggest pitfalls.
Yeah.
In front of me. I don't think I do, but
that's fine.
But anyway, it talks all about what you're talking about right now about this point. I'll just tell everyone who's watching this point that Jeff's about to talk about. I've gone and spoken to 2 attorneys in the last few weeks. I have 5 talks that we're putting on the books for next week and the following. So I'm going to be talking to a lot of attorneys the next couple of weeks. And I'll tell you, so far, the 2 that we've talked to, when we start talking about this, they're either taking notes. Like, I've never had them take notes before when we're talking. They're taking notes. Okay. Or they're stopping me and asking questions, right? Because they believe that the MRI and the disc is the biggest thing that they should be looking at. And so I'll just let you explain.
Right. So, you actually have 3 major findings. You can fracture something, or the ligament causes either disc herniation, you pick that up on MRI, or causes excessive motion, you pick that in stress radiology. So, but that second or first, however you want to order them, that excessive motion for ligament damage is the most serious injury they can have. And if they have disc injury without excessive motion, you remember there's a disc, 9 other ligaments around the disc. So if those supporting ligaments have been sheared, it's going to cause excessive motion with the disc herniation. Now you got the irritation of excessive motion with the disc herniation. When a patient has that, they're going to rehab differently. It's going to take longer, and it's going to take a while more to stabilize. You're going to have the rare person that comes in. We've all been in the room 75,000 times, 175,000 times as a practitioner. So treated a lot of patients. You're always going to have the rare, okay, I have no idea why that responded the way it did so quickly or whatever. You'll have every once in a while those. But what you'll see is that this stuff is really reliable as far as determining how injured the patient is. so you can walk that patient through what their route's going to be. But more importantly for the attorney is the attorney gets all of the injury documented. And now when the attorney says, oh, excessive motion, I'm not sure I understand it, and you hold up a surgical guideline that says, well, you see this excessive motion in the surgical guideline that says if they have this amount of excessive motion, they're pre-authorized, they can get a pre-authorization for spinal fusion surgery.
Mm-hmm.
And you take them through other, you can go to the AMA guides, you can go to return to play sports parameters. And see, the thing for me, Todd, is when I got into this, it validated chiropractic so heavily. I mean, so extreme. When I read the AMA guides in 1995, I said, oh my God, they took the spinal subluxation and they turned it into a 25% whole person impairment. And I went, well, why don't we know about this? That's a really high impairment. I'm crazy enough when I get into the impairment side. I mean, I've stood up in front of attorneys to try to give them something which they could understand and relate to. So a penis injury is a soft tissue injury. There's no bone in a penis, right? So I use that analogy to show them, okay, look, if you have this type of an injury, if you had a genital injury to the penis, right? How would you objectify how damaged that penis is? Well, there's a guideline. There's a guideline and tests in the book called the AMA Impairment Guides that tells you how you do that. They don't know that. So I liken the story to, hey, the guy comes in, he says he has a penile injury. He can't have sex with his wife. He had a little, thing up on his dashboard that was the old, metal stuff that you put your ashes in. He got rear-ended, flew off, hit him in the groin. The attorney thinks that he's being, pranked, right? The paralegal comes back and says, there's $3 million worth of insurance. So now he's serious. Oh my God, this type of injury is really serious. Well, it turns out that there are tests for that type of an injury where you're using an X-ray to determine how damaged that is. So of course, one of the things that comes up is you can't see soft tissue injuries on X-ray. Well, that's true, but you can see the effect of the soft tissue injuries on X-ray. Mm-hmm. And so, it just
and just to clarify for everyone, we're talking about the spine right now. We're not still talking about the penile injury, right?
Yeah, no, I'm just using an analogy. Okay. Well, here's the thing. When you get, it doesn't matter what subject you're really good at. When you get good at that subject, you can relate just about every subject around it very easily.
Right.
So sometimes it's easier, especially for attorneys, if I jump over and say, if I want them to understand the guideline book, right? I'll jump around and then I'll relate it back to the spine to, okay, this is soft tissue and this is soft tissue injury. Mm-hmm. When people say soft tissue injury to me, it's like, all right, that's a brain injury. That's a heart injury. That's a lung injury. But they don't think of it that way. Attorneys don't think of it that way. They think of it as like, oh, it's an injury that doesn't matter. So, just asking them a simple question, what soft tissue would you be willing to permanently damage? I mean, a hard tissue, I'm okay with a bone fracture as long as it doesn't damage the hard tissue. Mm-hmm. I'll be okay with a permanent callus. You know what I mean? Mm-hmm. So when you're working with attorneys, it really is easy once you have something unique to offer them. And Todd, I know you'll get into the, hey, I can go out and I can do this attorney to attorney. But you'll also get to the point where you could do 10 attorneys, 15 attorneys, 50 attorneys, be the keynote speaker for Utah Trial Association. You know what I'm saying?
Idaho.
Idaho.
Utah. But for some reason,
at least I don't have
in multiple times we've talked before, for some reason, I know you're going to come out here and visit us in Idaho. And so hopefully by then you don't fly into Utah. And then we're like, where are you? I'm at the airport about to pick you up. And you're like, man, I'm in Salt Lake City. Where to go?
I'm in Utah. Utah.
Yeah.
In Idaho. So the other thing that you can do is you can start to actually go out and train others on this. And it's pretty fun because there's nobody really in that market teaching them that. So it's like a wide open space within the personal injury market. And the biggest issue that I have with most doctors coming in my program, and I'll say to them, hey, go out to any doctor. I don't care if it's a medical doctor, an orthopedist, a neurosurgeon. Ask them, hey, are ligament injuries to the spine bad? They'll all say yes. You say, well, how do you determine the severity and location of that injury?
Right. And that's crickets.
Right. Yep. Okay. If that injury is so bad, but you don't know how to determine the severity and location of it, wow, it's a wide open market. And it sounds, it's too simple. Because you go, oh no, you'll start to belittle it. It's like, okay, no, there's not. The more you belittle it, the more problem you'll have in it, because it's really powerful in the fact that there isn't anybody in it.
Right.
And so, it gives you something to talk to the attorneys about.
Yep. So then from there, let's say you go in, you build this relationship with the attorney, they send you a patient.
Yep.
And then just kind of bird's eye view, briefly, because I know the purpose of this isn't to get into all the details. Yeah. Saturdays, we're going to dig a little deeper, but talk about a couple of points of what you're going to provide, or what a smart injury doctor getting into the program is now going to be able to provide to the attorney, that the attorney is going to say, wow, these other doctors I'm working with isn't doing this for me, and this is going to help me tremendously in this case.
Well, first of all, I'm going to teach you, there's 5 pieces of documentation that you got to have on every claim. It's how all claims are determined. And I would be willing to bet that all 5 of those, with the majority of the attorney's cases. So I'll just give you an example. When I go in an attorney and I want to prove a point of what I'm saying, we just go in and open up files. And the 5 things that I'm saying, there'll be some diagnostic codes in there. Usually they're not even injury codes, right? So the documentation that they're saying, that they're submitting to the insurance saying, give me money, is really bad. So it's very easy to go in and no, they'll hear it the first time, they'll hear it the second time, they'll hear it the third, you got to hear it. Mm-hmm. But, one of the things is you're giving them what they need and what the insurer needs in order to properly assess what are the benefits that patient is entitled to. So you're going to make their job easier right from there. Mm-hmm. Now, as far as what supplies do I give the doctor so that they can go in and do this? Once they understand what it is that they're doing in clinic, then we have PowerPoints, we have free reports, we have research, we have things that they can send to that attorney. And you would want to continuously send something out once a month to them, once every 2 months to them. Stay in contact with them to start to develop that relationship. And some of them are going to come on right away. Some of them are going to take a while. Some of them already have established relationships. But even there, see, the thing is, you don't just want to go to the attorneys, right? So if I say to Todd, you have 5,000 patients in your database. Let's just take that as a number. Let's say you have 5,000 people in your database. Okay, 550 of those people are going to have an injury incident every year. So if you want to build an injury practice, it's not just attorneys, it's not just medical doctors. You want to go to public, you want to go to your back end. Mm-hmm. You want to go all over the place, but you want to go, okay, here's what makes me unique. And now message that back out to your back end, message it out to your attorneys, message it out to your local medical doctors, message it everywhere.
Yeah, I just got done seeing patients, and during a shift, one of our patients had to leave in the middle of his appointment because his wife just got in a car crash. So it's like, yeah, it happens all the time. And so that's a piece of your program that we have not yet implemented yet, that we're going to work on, as far as getting some of those posters printed out to put them inside the clinic, using some of those PowerPoint slides that you have for the social media stuff to also play those on our slideshow in our clinic, so that we are educating our patients on the importance of something that just might not come up in conversation, or even though in our minds we think they fully understand the importance of getting checked out and doing proper testing after a trauma. Their own family member could have it and they haven't connected the dots yet, their neighbor, someone at work. So yeah, it is a very thorough approach that you take. It's not just going into the attorneys, correct?
Well, the other thing, Todd, just take that one person, right? So in the program, there's a staff training program. So when a person mentions that and says, "Oh my God, I got to leave," maybe you're not even, maybe they've never seen you, right? They decided they had to leave because they're sitting in the waiting room and they never got to the treatment room.
Something that they should have done is had the thing printed out already that they give to them that like talks about what, as far as all the things to do after a crash. I saw that inside your program too.
You can do that, but that staff member, here's the seed that staff member wants to plant. David, as soon as your wife is through the emergency room and everything else, they need to get into the clinic right away, because the biggest problem that they can have that's going to cause them to have a chronic problem if it's not diagnosed and treated early is a ligament condition. We specialize in that condition here. So you want to get that checked right away. Now, let's say that David's wife, Mary, goes to the emergency room and her friend has a friend that's a physical therapist, and she's now in the physical therapist's office, right? Okay. Now she's continuously treating, but she's continuously complaining about her neck. Your staff is going to say, "Hey, how's Mary doing? I told you, you need to," the sooner she gets in. So that seed in that patient is that something's missed. Something's being missed, because that's what's going to happen. Now, Todd, you froze up. Can you still hear me on my end?
No, I can hear you. I can hear.
Oh, wow, you were just that still.
I was just pretty still, I think.
Yeah, I think you were okay.
I was still here.
All right.
Well, it's because in the hypothetical where you just said David, I was like, that's actually the patient's name. His name was David. So it was kind of funny that you used that as an example. That's what I was thinking of. But
yeah, psychic.
So
his wife's name?
I don't think it's Mary. But just to circle back around those 5 things. Okay, those 5 things are things that you go through in the program.
Totally.
And it's probably 5 things that you can throw out here right now for everyone who's watching this.
No, totally. All the
5 things.
All the injuries documented.
Okay.
Any impairments covered if they have a permanent impairment. If they have a duties under duress or loss of enjoyment of life factor, you got to get it documented, both like early in treatment and later in treatment, to find out if it's changed.
Yep.
Should change. And then if they have an impairment and they have a duties under duress or loss of enjoyment of life factor when you're releasing them from care, then they also qualify for future care benefits when they have that. So those are the 5 things. Now, those 5 things, you can go through, you can take $2,000, $3,000, $4,000, $10,000 programs on Colossus, and you're going to come out and say, okay, on all that education, it was all great, 10,600 value drivers and how they interreact to each other. Those are the 5 basic things that you need to have. And they're also the 5 basic things that are on the Colossus website that they explain to insurance companies that they actually take and process in order to arrive at a settlement value. So, the nice thing about the stuff that I do and what I've learned to do for a long time is it's all verifiable. When I say it's all, nothing's 100% verifiable, 99% verifiable. The stuff that I present and say, okay, that's on a Colossus website. Anybody can go to DXC Colossus, who owns Colossus, go to the website and see how they're promoting selling it to the insurer and what they say it does for the insurer in order to arrive at a settlement value. Anybody can look that up tonight. Look it up. You go, okay, this is what it says. So there's another thing. The attorney says, well, we don't know anything about Colossus or whatnot. I don't know. Go to their sales website. It's telling you how that adjuster who's got 500 cases on his desk, what he's programming into the computer, so the computer gives him a number.
Gotcha. Interesting.
So,
yeah, and there's videos you have inside your program about that too. I've gotten through about probably 50% of the stuff. I'm diving back in little by little. I turned it over primarily to our associate doctor. He's been going through a lot of it. I showed you, he already typed up about 50 pages of notes on all the stuff from it. I mean, so I guess I would say this to the audience. Okay. In conclusion, it's something that you can dive in. You can get a lot of the simplicity of the message across very quickly. You can start implementing it quickly. You can start doing this in practice and practicing better and growing your personal injury reach. And then simultaneously, you can dive into the program and continue to engage and refine and sharpen and get it denser and tighter as you go. Okay. So it's something that I think fulfills both sides of it, where you can look at it, you can spend a weekend looking through it on and off, which is what I did. And on Monday I was pumped and I was ready to be like, okay, I'm going to make some changes now. Right. Like I'm going to change how I'm doing some things in personal injury. Now, so Saturday, Jeff and I are going to be on, and he's going to have it's going to be in a PowerPoint slide format, and then he's going to go behind the scenes, show you more inside the program, what it looks like. And literally this weekend is the last weekend until it jumps up in price to what I think is still a fair price, but it happens to be 5 times more than what it is right now. Okay,
I'm very transparent. The price is $997 right now for a lifetime. Now we'll never have I'll never give lifetime access to it again. So it's in other words, in the future it'll be $497, and then there'll be a recurring if you want to stay involved with it, you want to keep up. So right now it's $997, and there's no recurring. It's just a lifetime. We're just finishing off. It's the space in between a new launching a new product, and completing, going from this transition. Right now we're building websites, doing all kinds of stuff. So it's just in the transition period. I said, hey, if people want to get into it right now, it's $997. You definitely want to get into it. If you're in the personal injury market, I mean, one tip, like I get doctors that get in and say, okay, gosh, we used to get 50% reductions. I just got my first case paid in full. So we went from $11,000, where we normally have $11,000 worth of care, and we get $5,500 for that. I just got $11,000. Okay, that's already paid for that program. But now he gets to use that same knowledge for the rest of his career. Mm-hmm. Do you know what I mean? So it's just that's why I appreciate you having these, where we can just go, all right, these Facebook Lives to your group to say, hey, if you're interested in it, jump in.
Yeah.
In personal injury, jump in. It's time to jump in.
Yeah, and something I'll do is I'll put a link in here too, just how to get access to it right now, if you want to just join it right now too. And you should watch the webinar too, because we're going to cover some cool stuff over the weekend. But let's see.
Right. At that point, for some of you, going over the webinar where I go over in some access, you'll just go, oh, wow, this is over here. This is over here. This is.
Yeah. And actually, there was a link that I made. I'm finding that one because I just made one. I took a webinar that you and I did a while back.
Yeah.
I think I have that one here. I'll find it. Webinar replay, dominating the spinal injury ligament. Here it is. Cool, right there. And then I made, replay.
Oh, man, you're good with technical.
Boom. Hold on. Wait for it.
You're very good with this.
Wait for it. Okay, this is just put it in the comment section. Let's see. Make sure that pops up right. Takes a second here on Be Live, and there's definitely a play.
It's there.
Okay. And so that link should be clickable. Let me see. Figure this out while the world awaits. It's all right. The world's patient. They're good. Probably listening to this driving home from work right now, listening to the audio, or if you're on the East Coast, it's already 6:30. So probably still just leaving work. 6:30 for you right now, right?
Yeah, totally.
Okay. All right. Move now. Okay. So anyway, all the links are in the comment section. Saturday morning, we're going to go on. We're doing this at, 9 a.m. Mountain Standard Time, 11 a.m. your time?
Yep.
Okay. So if you're watching this and you're still like, I don't really know what it's about, I want to learn more, then jump on and join us. If you're already a member of it, jump on too, because what it'll do is help light more of a fire under you, give you some more direction of how to use it, give you some talking points. It's good to hear this stuff over and over again. Truth be told, I mean, I learn something every time that you and I have a conversation. So it's always helpful. It always, and then on top of that, it always incites for me to then ask more questions that I didn't even think of. Like there's a couple that you just talked about today that I'm trying to think of what you said that I had a question about. I'm sure I'll remember it soon. Watch, I'm gonna share my screen real quick so I can show you what this looks like. Let's see, share screen and application window, and here. All right, so this is something that it's kind of small.
I mean, it's small, but
yeah, it's small. But what it is this is a page that we built. This is a webinar we did last weekend, and there's some different stuff we talked about. It went for 58 minutes, but then on this page it says price goes up. It's going up to $4,997. A little asterisk next to it because that's going to happen in 3 days. It says the Smart Injury Doctor program will be going up to $4,997 and then $997 per year. Current price for Move Now You community members and non-members is only $997 for lifetime access, no recurring fees. So jump on it now, and then you click on that button, and it takes you to the point where you can join and you get access. And
that's nice. You just do that so quickly with ClickFunnels.
Yeah, isn't that cool?
Yeah.
Yes. ClickFunnels is our friend. And ClickFunnels is something that we actually do a lot inside of our program. There's a lot we build in ClickFunnels. So our doctors use ClickFunnels, and then we can share these things that we build that take us hours and weeks. And then they just basically hit one button, they pull it into their ClickFunnels account, and they can use it in their practice and for marketing and all kinds of cool stuff.
Do you use the Actionetics and the?
I do. Yep. I do. I use Actionetics with it, but most ClickFunnels users, like most of the doctors out there who are using ClickFunnels for what they need for their practice, don't need Actionetics. I use it because I use ClickFunnels also for all of our Move Now University stuff. So we're communicating with all of our chiropractors that way. So anyway, cool. Well, good. All right. I guess we'll end this over and out. And if not, you and I will have a conversation on here for 20 minutes while everyone watches. And so, all right, we'll see you this Saturday then. Register, or if you want to join the program, you can jump in now. But regardless, Dr. Cronk and I will be there on Saturday.
Sounds good. Thanks, Todd.
Cool. All right. Thank you. Bye.
All right. Bye-bye.